Hey everybody, it's Manny Moustakakis again. I'm live right now at the outside the ambulance bay at New York Presbyterian Queens in Flushing, New York. I just came in. It's about 4 o'clock in the morning in New York City. Right now, I just finished with an emergent angioplasty for somebody who was having a heart attack. I got a call about 2:30 in the morning. We came in and took care of it. And you know, the cases like this, I'm always wound up afterward, and it's hard to really come down and go back to sleep. So I thought I'd do a quick video on what to recognize if you think you might be having a heart attack, because this is really important. Understanding that minutes count. There's a classic saying in cardiology that time is muscle, and it's really based on the fact that when you're having a heart attack, it's really a lack of blood flow that's getting to your heart, and it's really a problem that's time sensitive because the heart muscle is actively dying and scarring. So you want to get to the hospital as fast as you can and get this taken care of as quickly as possible. The problem is it's not always so obvious when you think about what symptoms might be. In the movies, it's always classic, somebody's clutching their chest and screaming in severe chest pain, but it's not always that. I mean, yeah, it's a lot of times it's severe chest pain. Sometimes it could be just be a sudden shortness of breath. Sometimes it could be abdominal pain. It could be throat and arm and jaw pain or numbness. It could be loss of consciousness. What I always tell people is that when you just know, it's not necessarily something that is always the most obvious or the same thing. You know, it can be very subtle, but I tell people, if you're having a heart attack or if you feel like something's wrong, you just know. So what do you do if you think you might be having a heart attack? Number one is call 911. Absolutely. You want to get to a hospital by ambulance. You do not want to drive yourself. You do not want to take a cab. You do not want to walk. Why? A couple of big reasons. One is that ambulances have lights and sirens, and they can cut through traffic. And in places like New York City, there's always traffic. Even at 4 o'clock in the morning, you never know when you might run into construction or some kind of roadblock or something. But in general, lights and sirens get through traffic where your car just doesn't. But the other thing that's just as important is that you could have problems before you get to the hospital. You can have a cardiac arrest. That's not uncommon. If you have that in an ambulance, a paramedic has a defibrillator and is trained to shock you. If that happens in your car, unfortunately, that's going to be a big problem. You could go into respiratory distress. You could have trouble breathing. You could need emergent medications. Paramedics can do all of that stuff, where in your car you just can't. And last is that paramedics can call ahead to the hospital and let them know that you're coming. This case that I did tonight was a call from a paramedic that called about 10 or 15 minutes before the patient even got to the hospital. So the ER was ready, the team was ready, and the patient got taken care of very quickly. You know, so the other thing that you should do after you call 911 absolutely is chew an aspirin. Aspirin is one of the great medications in medicine in the history of cardiology. It actually reduces the risk of dying from a heart attack by over 20%. So chew an aspirin while you're waiting for the paramedics. And you know, but again, come by ambulance. If you come in your car, it might go okay, but if you have a problem, that could be a life-threatening issue. So thanks again for watching. I'm gonna try and unwind and come back down from this and get a few hours of rest myself. But I hope you will take a minute to comment below if you found this helpful. Let me know where you're watching from. As always, I'm in Flushing, Queens in New York City. I hope that you will let me know where you're watching from. And if you know anybody who might find this helpful, I hope this is helpful. I hope you will take a moment to share this with the important people in your life. Aspirin and calling 911 can be all the difference. I've seen it many times. So have a great day, everybody, and I'll see you again soon.